Hello, my name is Cedar Parrott, and this is my research proposal. It's titled How Static vs. Dynamic Stretches Affect High School Athletes' Chance of Injuries. The introduction: my name is Cedar, as I said. I've graduated in the spring of 2017 from Cal State Bakersfield with my bachelor's in kinesiology, and that I'm currently finishing my single subject teaching credential in physical education. Right now I'm student teaching, sometimes I substitute. I'm also an assistant coach for the varsity and JV girls basketball at the high school that I'm student teaching at, and that I also sub at. So for my proposal, the major research findings include proposing findings between stretching and injury prevention programs to prevent injuries or decrease injury rates. So certain ones say that dynamic stretching is good, some say that static stretching is good, and most of them are only specific to one sport. So sport-specific injury prevention programs look at athletes in different sports and the risk factors they have for specific injuries related to that sport. So many research articles specify for one sport on what's the best program to for the least injury. So overuse injuries happen in more sports that have higher repetition of movements, and stretching before and after a sport or activity is important because it helps the muscles remain flexible and warms up the blood and core body temperature so you don't strain or injure yourself during activity or gameplay. So static versus dynamic stretching. So static stretching is stretching at rest, while dynamic stretching is stretching with movement. So static stretching, after you do it, your soft tissues and muscles will be lengthened for up to 24 hours after the stretching, but the muscles are only the longest up to 15 minutes after you stretch. So this is best done after dynamic stretching, and dynamic stretching mimics activity being performed and usually is done as a warm-up, so like a jog or plyometrics, to get your body core temperature to increase. And the findings show that a combination is actually the best option, so dynamic stretching with sport-specific movements and static stretching after. So the purpose of my proposal is to compare high school athletes who stretch using dynamic stretching versus static stretching versus static with dynamic stretching, and to compare which one is better at preventing injuries during practice or during a game. The research question that I have is, which stretching technique, dynamic or static, or dynamic combined with static, is best at preventing injuries in high school athletes? So the methods proposed, the study design would be cross-sectional study, because it would look at different sports. So there would be the same amount of males and females, and they would be from sports that are high, like some anaerobic or aerobic activities, so a lot of running, or compared to ones that have like less running. And they can also compare between the different demographics or the injuries, the amount of injuries that are reported by the athletes. And then experimental design would be the quasi-experimental design, because this study can be used in a real, or can be done in a real setting, but it could be controlled as needed. So the methods continued, participants would be as I said, the same amount of male and female, and they would be high school athletes from various sports. There would have to have at least participated in one high school sport for the school year, and to have played one specific sport for at least 2 high school years, and that would be the sport that they would be doing at the time of the study. And then the instruments would be a survey, so a self-assessment, and then they would be given a randomized stretch protocol. So they would either be dynamic, static stretching, or dynamic with static stretching that they would have to do. They would all have to do the same one before, after, or both the activity or sport. So procedures, they would self-report prior to the study. They would self-report their current injuries, and then they would be randomly assigned to a stretch protocol group, and the injuries would be reported after each practice or games, or at a set time during the study, to see how it compares to the baseline of how much they've had prior or at that current time. So the data analysis, the dependent variable is the occurrence of injuries, while the independent variable is the type of stretching intervention. And then because of this, the average number of injuries would be compared on how many is before or after the intervention, and it will be graphed on a t-test, so a linear regression model, to see how each compares to the other participants. So the application, so who cares, would be the athletes, the coaches, and professionals, which I put as a PE teacher because that's what I'm currently working as and student teaching as. So why would coaches, athletes, and PE teachers want to do this? Would be because this would help preventative measures to lessen the occurrence of injuries that happen often in a sport or an activity. And looking at all the studies and research, there's a lot of studies that compare injury prevention programs and different warm-up techniques, and athletes, coaches, PE teachers, and athletic trainers, other professionals like that, should be looking at how athletes perform and correcting the fundamental movements, because that can lead to injury. So that's part of the injury prevention programs, and also how to control the injuries due to overuse. So making sure that they do the right stretches before an activity will lead to less injuries. So, in conclusion, there are many studies that compare specific injury prevention programs and stretch protocols for a specific sport. So I read some on soccer and on maybe a specific injury related to overuse, but there is not any research that I found that includes sports that are different in the same study. So I think that this proposal would be good because they could use many different athletes from different sports and compare their injuries. And I think it's important to know which protocol injury prevention program is best for different athletes in different positions within different sports. So that would be beneficial to the athletes, the coaches, and because even in a specific sport, specific positions might do different things. So they might need a different stretch routine, warm up routine. And that's all.